think of when you hear hepatitis? Do you think of having to get your shots for school, or do you think of jaundice and liver disease? Hepatitis can occur from an excessive use of alcohol, medications, or certain medical conditions. However, you can also develop hepatitis from a virus. There are three main types of viral hepatitis: A, B, and C. Here are some graphs from the Viral Hepatitis Surveillance Program for 2018. They show reported acute cases and estimated acute cases. For hepatitis A, there were 12,474 acute cases reported, with an estimated 24,900 infections. For hepatitis B, 3,322 cases were reported, 21,600 were estimated. And for hepatitis C, 3,621 cases were reported, 50,300 were estimated. Hepatitis A incidence increased 850% from 2014 to 2018. The increase in 2018 was primarily due to unprecedented person-to-person outbreaks reported in 24 states among people who use drugs and people experiencing homelessness. Rates of acute hepatitis B remained low in children and adolescents, likely due to childhood vaccinations. However, over half of acute hepatitis B cases reported to the CDC in 2018 were among persons aged 30 to 49 years. Rates of acute hepatitis C increased in 2018, particularly among those aged 20 to 39 years, consistent with age groups most impacted by the nation's opioid crisis. The populations most at risk for contracting hepatitis A are international travelers, men who have sex with men, those who inject drugs, those experiencing homelessness, and healthcare and public safety workers. For hepatitis B, the population is infants born to infected mothers, sex partners of infected people, men who have sex with men, those who inject drugs, those on hemodialysis, and healthcare and public safety workers. For hepatitis C, this is infants born to infected mothers, people with HIV, those who inject drugs, prior recipients of transfusions or organ transplants, those on hemodialysis, and healthcare and public safety workers. These are the people that the CDC recommends getting vaccinations. Early epidemics of jaundice were reported in the time of Babylonia and ancient China. Disease outbreaks called epidemic jaundice or campaign jaundice plagued armies and civilians during medieval wars. In the 1950s and 60s, Saul Krugman, a New York University researcher, performed experiments with HIV on mentally disabled children at Willowbrook State School in New York. This research remains controversial and is widely regarded as unethical. One result of the experiment was a better understanding of the differences between serum hepatitis, which is spread by blood transfusions, and infectious hepatitis, which is spread directly from person to person. In 1977, Stephen Finestone at the National Institute of Health successfully identified a new agent in stool samples. Soon after, a specific serology for HIV antigen in stools and HIV antibody in serum was developed. This research led to the development of a vaccine. In the 1950s, Dr. Baruch Blumberg, a researcher at the National Institute of Health, discovered what he called the Australian antigen for HBV while he was researching lipoprotein genetics. It was later renamed the hepatitis B surface antigen. Dr. Blumberg continued to study the antigen and eventually developed the first vaccine, which won him the Nobel Prize in Medicine in 1976. In 1974, research groups at the National Institute of Health discovered non-A and non-B hepatitis in individuals post-blood transfusions. This was identified as hepatitis C. Symptoms of hepatitis include fever, fatigue, loss of appetite, nausea, vomiting, dark-colored urine, clay-colored stool, joint pain, and jaundice. HAV symptoms usually last less than 2 months, but can last for 6 months. The average incubation period is 28 days, but can be as long as 50. HAV does not become a chronic, long-term disease. Most people with chronic HBV infections are asymptomatic. If symptoms do occur, they begin an average of 90 days after exposure. Symptoms typically last for several weeks, but can persist for up to 6 months. Most cases resolve on their own, but can progress to chronic hepatitis. Chronic HBV and HCV can progress to cirrhosis of the liver. People with HCV infections are usually asymptomatic or have mild symptoms. In acute HCV, the average exposure to symptom onset is 2 to 12 weeks. In chronic HCV, there are no symptoms or nonspecific symptoms such as chronic fatigue or depression. This can develop to chronic liver disease. The above picture shows a healthy liver, a fatty liver, and a cirrhosis liver. The picture to the right shows a person who has cirrhosis of the liver. The bottom picture illustrates someone with jaundice. Hepatitis has 4 stages of progression: incubation period, prodromal phase, icteric phase, and recovery phase. Hepatitis is diagnosed through a serology test. These are blood tests that screen for antibodies and antigens. HAV is spread indirectly through the fecal-oral route. HBV and HCV are spread through blood and body fluids. Standard precautions should be taken when working with a patient who is positive for any viral hepatitis. This includes the use of face masks, goggles, and gloves. Vaccination is the best prevention against hepatitis. HAV has 2 types of vaccines: single dose given as 2 shots 6 months apart, and a combo vaccine that protects people against HAV and HBV. HBV also has 2 types of vaccines: single antigen vaccines given in a 3-shot series, and combo HAV and HBV, and combo HBV, DTaP, and IPV vaccines. HCV has no vaccine. Treatments for hepatitis are limited, but include supportive treatment, regular monitoring for signs of liver disease progression, antiviral drugs, and oral therapy. Now that you're all experts on viral hepatitis, I have 2 questions for you. What can you do as a healthcare worker to avoid contracting viral hepatitis? And which viral hepatitis does not have a vaccine?